Heart blocks. Heart blocks is an abnormality in the electrical conducting system of the heart. So it is classified into three main types based on the severity. First degree heart block, there is a delay in conduction of impulses through the AV node. As you can see in the ECG diagram here, P wave represents atrial activity, QRS complex represents ventricular activity. Normally, initially atria is stimulated followed by the ventricle stimulation, right? So this impulse from atria will spread via AV node and then reaches the ventricle. So now here what has happened, there is a delay in conduction of impulse from atria to ventricle, which is called as first degree heart block. The PR interval normally would be like in this first degree heart block cases would be more than 20 seconds, but there is no dropped beat, meaning one P wave is followed by another QRS complex. Usually these patients will be asymptomatic, so they don't require usually treatment for this condition. Second degree heart block, there are two subtypes, Mobitz type 1 and Mobitz type 2. Mobitz type 1 is Wenckebach phenomenon. If you see here, there is a progressive prolongation of the PR interval until a QRS complex is dropped. If you see in the ECG, what is exactly happening is the PR interval is gradually prolonging or lengthening. Eventually, P wave is not followed by a QRS complex. These patients are usually asymptomatic, but sometimes they can have mild dizziness. Mobitz type 2 is there is an intermittent failure of conducting of impulses from atria to ventricle. So if you see here, PR interval is constant, but suddenly there is a dropped beat. Only difference between type 1 and type 2 is that there is a constant prolongation of successive PR intervals followed by a dropped beat in type 1. But in type 2, the PR interval is constant, but suddenly a missed beat is there. Dropped beat is nothing but P wave is not followed by a QRS complex. Third degree heart block, meaning there's a complete heart block. See, P wave represents atrial activity, QRS complex represents ventricular activity. So if you see here, there are 4 P waves recorded, but only 2 QRS complexes. It means in this time duration, atria has contracted 4 times, but ventricle has contracted only twice. It means there is a complete dissociation between atrial and ventricular activities. These patients will have severe fatigue, syncope, or heart failure. Most common cause would be inferior wall MI in this, and these patients immediately require a pacemaker as a treatment. Just to summarize here, there are 3 types of heart block: first degree, second degree, third degree heart block. In first degree heart block, the PR interval is more than 20 seconds. It is constantly prolonged. Okay, but all the atrial impulses are conducted to ventricles. But if you see in type 2 and type 3, all the atrial impulses are not conducted to ventricles. In what is Wenckebach phenomenon, there is a constant prolongation of PR interval followed by a missed beat or a dropped beat. In a complete heart block is nothing but Stokes